Imagine, just for a second, you're in a hospital bed.
Okay.
You're feeling, well, vulnerable,
Right.
maybe even a little scared.
Yeah.
Who's the person you see most often? The one explaining what's happening, answering your questions, advocating for your needs. It's a nurse, right?
Most definitely.
Today we are taking a deep dive into the world of nursing,
Okay.
a profession that literally touches every single one of our lives.
It does.
We'll uncover what makes nursing tick.
Right.
We'll explore its history, challenges, and the incredible impact it has on healthcare as a whole.
Yeah.
Think of this as like a crash course
Okay.
on everything nursing,
Sounds good.
from its humble beginnings
Yeah.
to the trends that are shaping its future.
I think what's really fascinating about nursing is its constant evolution.
Right.
It's a field that adapts to societal needs, embraces new technologies, and is really pushing the boundaries of what healthcare can be.
Exactly. Let's start with the basics.
Okay.
What is nursing, really?
Well, the International Council of Nurses,
Okay.
ICN for short,
Wow.
they define nursing as assisting individuals,
Okay.
whether they're sick or, well, in activities that contribute to their health, their recovery, or even a peaceful death.
That's a pretty powerful definition.
It is.
It really highlights how nurses are there for us
Yeah,
throughout the entire spectrum of life.
they are.
So supporting us in moments of vulnerability and really empowering us
Right.
to maintain our own health.
Absolutely. And this dedication to helping others,
Yeah.
that's what elevates nursing to a profession.
Okay, so we hear that phrase a lot.
Mm.
Nursing is a profession, but what does that actually mean?
Right.
What sets it apart from just any other job?
That is a good question.
Yeah.
So profession,
Yeah.
it's distinguished by several key characteristics.
Okay.
First, it requires extended education and specialized training.
Right.
Think about it.
Yeah.
You can't just become a nurse overnight.
All right.
It takes years of dedicated study and hands-on experience to develop the knowledge and the skills to provide safe and effective care.
You're right. And it's not just about acquiring knowledge, right?
Oh.
It's about applying it in a specific service to society.
Exactly.
The promotion, restoration, and maintenance of health.
Right. Nursing addresses a fundamental societal need, and nurses are on the front lines meeting that need every single day.
Absolutely.
Every day.
And this is where it gets really interesting to me.
Okay.
This concept of autonomy.
Yeah.
Nurses have a certain level of independence in their decision-making and practice.
Right.
What do you think about that?
Autonomy is, it's crucial in nursing. It allows nurses to use their expertise to make real-time judgments.
Yeah.
Based on their patients' unique needs.
Right.
They're trained to assess situations, to analyze information, and make decisions that can have a significant impact on patient outcomes.
That's amazing. So it's like they're empowered to be like problem solvers and advocates for their patients.
Exactly.
That's pretty powerful.
And to ensure that this autonomy is used responsibly and ethically, nursing, like any other profession, operates under a strict code of ethics.
Okay.
This code guides nurses in their decision-making, ensuring that they prioritize the well-being of their patients above all else.
So it's like a moral compass.
Yeah, you can think of it that way.
Guiding them through those really complex situations where there might not be an easy answer.
Right, exactly.
Now, let's dive into the scope. It's standards of practice that really provide the framework for nursing care.
Yeah.
Think of these standards as a roadmap, right? That helps nurses navigate the complexities of their work.
Exactly.
It ensures consistency, accountability, and above all, patient safety. So these standards are divided into three main pillars.
Yes.
Standards of practice, which outline the competent level of nursing care.
Okay.
Standards of professional performance,
Yeah.
which focus on the behavior of the nurse, and then the code of ethics, which we already touched upon.
Right.
So it's not just about what they do, but how they do it.
Exactly how they do it, exactly. And these standards, I imagine, are constantly evolving.
They are, yeah.
To keep pace with the changing demands of healthcare.
That's right.
Speaking of standards,
Okay.
the American Nurses Association, or ANA,
Right.
has set specific standards for professional nursing performance.
Right.
They really lay down the law.
They do.
When it comes to what's expected of nurses?
Absolutely. The ANA has identified key areas where nurses need to really excel to provide high-quality care. This includes maintaining quality of practice.
Pursuing continuing education, collaborating effectively, and demonstrating leadership qualities.
So it's not just about being clinically skilled.
It's not, no.
Right. It's about being a well-rounded professional.
Absolutely.
Who's committed to lifelong learning. And contributing to the advancement of the profession as a whole.
That's right.
And the ANA standards really emphasize that nursing is multifaceted.
It is, yes.
And requires a diverse skill set to meet the complex needs of patients.
Absolutely.
It's pretty clear to me that professional nursing practice, it goes way beyond just performing tasks. It's about understanding the legal framework, navigating ethical dilemmas, and blending scientific knowledge with the art of caring.
That is a great point. You really hit the nail on the head. The legal framework, especially the Nurse Practice Act, is crucial because it defines the scope of practice for nurses, outlines licensing requirements, and establishes standards for education and conduct.
It's like the rule book, that ensures that nurses are operating within the boundaries of their profession and providing safe and ethical care.
Exactly.
Before we move on, I want to take a quick moment and give a shout out to London HeartbeatsZ Academy, UK.
Great.
They've been instrumental in supporting our deep dive into nursing, and we encourage our listeners to check out the amazing resources that they offer.
Absolutely. So London HeartbeatsZ Academy, they are dedicated to providing top-notch healthcare education. They have over 140 healthcare courses to choose from.
That's amazing.
So whether you're interested in becoming a nurse or just simply want to learn more about healthcare, they have something for everyone.
That's fantastic.
And the best part,
what's that?
They're active on social media. So you can connect with them on Facebook, Instagram, Spotify, and YouTube.
That's great.
To stay updated on their latest courses and events.
Wow.
And while you're at it, subscribe to their channels so you don't miss out on future discussions like this one.
That's great advice.
Yeah.
All right, so now back to nursing.
Back to nursing.
Where were we?
We were talking about the evolution of nursing. We need to...
I love history.
Yes.
It's like looking back at the roots of a tree to understand how it grew so tall and strong.
That's a good analogy.
Right.
Yeah.
So who were some of the pioneers that shaped the nursing profession?
Well, we can't talk about nursing history without mentioning Florence Nightingale.
Of course.
She was a true visionary, a real trailblazer who transformed nursing during the Crimean War.
I've always been fascinated by Florence Nightingale. She was a force to be reckoned with.
She was.
Challenging traditional practices, advocating for improved conditions for soldiers. She truly embodies the spirit of nursing.
She does. Absolutely. And her legacy continues to inspire nurses today. Another influential figure is Dorothea Dix, who dedicated her life to advocating for the mentally ill. Her efforts actually led to the establishment of hospitals and asylums across the United States.
That's incredible.
Providing much-needed care and treatment for a really vulnerable population.
It's amazing how one person's passion and dedication can create such a ripple effect.
Right. Absolutely.
Improving the lives of countless individuals.
Yeah.
Speaking of making a difference, we can't forget Clara Barton.
Of course not.
Right.
Yeah.
The founder of the American Red Cross.
Clara Barton was an angel of mercy, providing compassionate care to soldiers on the battlefield during the Civil War.
Right.
Her tireless efforts actually led to the establishment of the American Red Cross.
Wow.
An organization that continues to provide humanitarian aid and disaster relief around the world.
She was a true embodiment of selflessness.
She was.
Right.
Yes.
And service to others.
Absolutely.
Her legacy reminds us that nursing, extends beyond hospital walls.
It does.
Reaching those in need, wherever they may be.
That's right.
And let's not forget. Isabel Hampton. Rob.
Yes.
A pioneer in nursing education and leadership.
She was a true pioneer. She advocated for shorter working hours for nurses.
Okay.
Founded the American Nurses Association.
Right.
And played a key role in establishing standards for nursing education.
So it's incredible to see how these early pioneers lead the groundwork
they did.
For the professionalization of nursing. Advocating for better working conditions, educational standards, and a unified voice for nurses.
Absolutely. And building upon their foundation, Dr. Mildred Montag championed the associate degree in nursing, making nursing education more accessible and creating a pathway for countless individuals to enter the profession.
It's amazing how the profession has evolved over time.
It is,
Right. Yeah. Adapting to societal needs, embracing new challenges.
That's right.
Nursing today is a far cry.
It is.
From those early days.
Yeah.
It's no longer just about bedside care.
No, not at all.
Right.
The field has expanded dramatically.
Okay.
Offering a wide range of career paths for those who are drawn to the caring professions.
So we have your registered nurses, RNs, who provide direct patient care, administer medications, educate patients and families.
Right.
They're like the backbone of the nursing profession.
Yeah, absolutely. RNs are highly skilled professionals who play a critical role in ensuring that patients receive safe and effective care.
Okay.
And then you have licensed practical nurses, or LPNs, who work under the supervision of RNs, providing basic nursing care and assisting with daily living activities.
So it's a true team effort.
It is.
Right. With different levels of expertise working together to provide that comprehensive patient care.
And we're also seeing a rise in advanced practice nurses, like nurse practitioners, who can diagnose and treat illnesses, prescribe medications, manage patient care independently.
That's incredible.
It is.
It seems like the role of nurses is expanding.
It is, yes.
Right.
Yeah.
Taking on more responsibilities, becoming even more integral to the healthcare team.
Yes. And then we have clinical nurse specialists who focus on specific patient populations or areas of expertise.
So like cardiology, oncology, pediatrics.
Exactly.
Okay.
They provide advanced care and contribute to research and education within their chosen specialty.
It's like they're taking nursing to the next level.
We are, yeah.
Right. Becoming true experts in their fields.
That's right.
And we can't forget nurse midwives.
Of course not.
Who provide comprehensive care to women during pregnancy, labor, and delivery.
Right.
Right. They empower women to have safe and fulfilling birthing experiences.
Absolutely. It's about recognizing the unique needs of women throughout their pregnancy journey.
Okay.
And providing individualized care and support.
I love that.
So important.
Yeah, and finally we have certified registered nurse anesthetists, or CRNAs, who administer anesthesia and provide pain management during surgical procedures.
Exactly.
They have a high level of expertise.
They do.
And play a critical role
in
ensuring patient safety during surgery.
Yeah. It's a very specialized role.
Yeah, it's incredible to see the sheer variety of roles within nursing.
Yeah.
It really makes you appreciate the depth and the breadth of this profession.
Now let's shift gears a bit and talk about nursing trends.
Okay.
These are the forces that are shaping the future of the profession.
Okay.
Influencing the care that we receive and impacting healthcare as a whole.
So when we talk about trends, we're talking about general directions and tendencies, right?
Exactly.
Within the profession.
They reflect changes happening in society and other professions within nursing itself and even on a global scale.
It's like a giant web of interconnected influences.
It is.
Right.
Yeah.
All converging to push nursing forward.
Absolutely.
So let's start with social change.
All right.
It's a powerful force.
It is.
Right. That has a direct impact on the nursing profession.
A great example of this is the incredible work being done by the Indian government to deliver health care in rural areas.
Right.
This initiative has created a huge demand for skilled nurses who can provide quality care to underserved populations.
That's fantastic.
It is.
It shows how societal needs directly influence the demand for an evolution of nursing services.
Right.
And thinking more broadly.
Yeah.
Have you noticed any societal changes?
I have, yeah.
Impacting healthcare in your own community?
Well, social change isn't just about government initiatives.
Yep.
It's about broader shifts in demographics, attitudes, and priorities.
For example, we're seeing more women pursuing higher education and entering the workforce.
Yeah, absolutely.
This has obviously had a huge impact on nursing,
right?
Given that it has traditionally been a female-dominated profession.
This shift has led to a greater emphasis on professional development, leadership opportunities, and work-life balance within nursing.
And we can't ignore the impact of technology.
We can't, no.
Right. Advancements in automation, industrialization, urbanization are changing the way healthcare is delivered.
Right.
And nurses are right at the forefront of integrating these new technologies into their practice.
Yeah, it's no longer just about bedside care.
Right.
It's about utilizing telemedicine, electronic health records, sophisticated monitoring systems to enhance patient outcomes and improve efficiency.
So it's like nursing is embracing the digital age.
It is.
Right. Using technology to provide better, faster, and more personalized care.
That's right. And let's not forget about government efforts to meet the evolving health needs of the population.
Right.
The recommendations of the Poor Committee in India,
for instance, have led to significant investments in healthcare infrastructure and training programs for nurses.
So these efforts are crucial, right?
They are, yeah.
For ensuring access to quality care.
Absolutely.
For all.
Yeah.
Regardless of location or socioeconomic status.
It's about creating a more equitable and just healthcare system.
Absolutely. I love that.
Good.
Now, it's important to remember that trends in nursing don't occur in isolation.
They don't, no.
Right. They're closely tied to changes happening in other professions.
They are.
Particularly in medicine. Right.
Yeah.
Medicine and nursing are like two sides of the same coin.
Yes.
Right.
Yeah.
Working together to provide that comprehensive patient care.
For instance, the rise of specialization and super specialization in medicine has created a need for nurses with highly specialized skills and knowledge. Think about the complex care required in units. Like intensive care units, coronary care units, organ transplant units. These highly specialized areas demand a level of expertise that goes way beyond those traditional nursing roles.
You're absolutely right. The symbiotic relationship between medicine and nursing is evident in the way advancements in one field drive innovation in the other.
Absolutely. It's a fascinating interplay.
It is.
That ultimately benefits patient care.
And it's not just about external influences either.
Right.
There are significant changes happening in the nursing profession itself.
Like what?
So, for instance, there's a growing push for higher education within nursing. With many advocating for the Bachelor of Science in Nursing as the entry-level degree.
So this move towards higher education is really transforming the role of nurses.
It is.
Yeah?
It is, yeah.
Enabling them to take on more complex responsibilities and leadership positions within healthcare.
It's about recognizing the intellectual rigor and critical thinking skills required of modern nurses.
Right. They're not just following orders anymore.
They're not. No. They're actively involved in decision-making and shaping patient care.
And with this shift toward higher education comes the discussion, right?
Yes.
About tuition fees and working conditions.
Absolutely.
We're seeing trends towards paid stipends, free housing, provided meals and uniforms during training.
Yeah.
But with the expectation of dedicated service in return.
Right. It's a complex issue with no easy answers.
Yeah.
But it highlights the need to invest in nursing education and create a supportive environment that attracts and retains top talent.
It's not just about attracting new nurses.
It's not, no. It's about retaining experienced nurses and providing them with opportunities for professional growth and advancement.
Absolutely.
Absolutely.
And speaking of the global landscape, let's not forget about the impact of international influences on nursing trends.
Globalization has led to an increased exchange of ideas, best practices, and research within the nursing community.
It's like nursing is becoming a global village.
It is.
Right.
Yeah.
Sharing knowledge, collaborating to improve healthcare worldwide.
That's right.
The rise of post-basic degree programs in many countries is a testament to this trend.
It is.
Nurses are seeking to expand their knowledge base and specialize in areas that align with global healthcare priorities.
Exactly. And organizations like the International Council of Nurses are playing a key role in promoting collaboration and setting standards of practice that transcend national borders.
So it's incredible to see how nurses around the world are coming together.
They are.
Right?
Yeah.
To address common challenges and improve healthcare for all.
It truly is a global effort.
Now let's dive into some of the key issues facing the nursing profession today.
Okay.
These challenges have significant implications, right? For the future of healthcare.
Yes.
And will require innovative solutions and a collective effort to address them effectively.
One of the most pressing issues is the status of nursing in society.
Okay.
Despite the vital role that nurses play, there's often a lack of understanding and appreciation for the complexities of their work.
So it's like they're the unsung heroes of healthcare.
Yes.
Right.
You could say that.
Working tirelessly behind the scenes to provide that essential care and support to patients.
This lack of recognition can manifest in inadequate staffing, limited resources, and a lack of involvement in decision-making processes.
Yeah, that's so frustrating. Nurses are the ones on the front lines.
They are.
Right. Interacting with patients daily.
Every day.
Yet their voices aren't always heard when it comes to making those decisions about patient care.
You're absolutely right. And it's not just about recognition. It's also about the value placed on nursing.
Right.
While there's growing awareness of the importance of nurses, this isn't always reflected in compensation benefits or career advancement opportunities.
This undervaluation can lead to burnout.
It can.
Right.
Yeah.
High turnover rates and ultimately a shortage of skilled nurses to meet the growing healthcare needs of the population.
It's a vicious cycle that needs to be broken.
It really does.
Investing in nursing, both in terms of compensation and professional development, is essential for ensuring a sustainable workforce for the future.
Absolutely. And when we talk about the future of nursing, we can't ignore the issue of quality of care.
And nurses are constantly striving to deliver the best possible care to their patients. But factors like inadequate staffing, limited resources, and a demanding work environment can make this incredibly challenging.
It's like they're being asked to do more with less, and that can take a toll.
It can. Right, and that can take a toll on both the nurses and their patients.
And speaking of education, the evolving landscape of nursing education is another key issue.
It is.
With the push for higher education, there's an ongoing debate about the best pathway to enter the profession and how to ensure that all nurses have access to quality training.
It's a complex issue.
It is.
But it highlights the importance of creating multiple entry points into nursing while also ensuring that all nurses have the opportunity to advance their education and specialize in areas that align with their interests and the needs of the healthcare system.
And let's not forget that the role of nurses is constantly evolving.
It is.
Right.
Yeah.
They're taking on more responsibilities, leading teams, playing a more active role in shaping healthcare policy.
Absolutely.
That's really exciting to see how nurses are stepping up and becoming leaders in healthcare.
Right.
So what do you think are the most important qualities of a good nurse? Is it clinical expertise? Compassion? Communication skills? Or a combination of all of these factors?
It's definitely a combination of all of those qualities. A good nurse needs that strong foundation of knowledge and skills, but they also need to be compassionate, empathetic, and able to connect with their patients on a human level.
So it's about seeing the person behind the illness.
Exactly.
Right. Treating each patient as an individual with unique needs and concerns.
Absolutely. Now let's zoom out a bit and consider the broader context of current trends and issues in healthcare. These trends have a direct impact on the nursing profession and will shape the future of healthcare delivery.
One of the biggest challenges we're facing is the nursing shortage.
It is a huge challenge.
It's a global issue.
It is.
With complex contributing factors.
Yeah.
And it's having a ripple effect on healthcare systems around the world.
You're absolutely right.
Right.
The reasons behind the nursing shortage are multifaceted, ranging from challenging work environments and recruitment difficulties to retention issues and an aging workforce.
So it's like a perfect storm of factors.
That's right.
That are putting a strain on the nursing profession, making it difficult to meet the growing demand for healthcare services.
Burnout is a major concern, as nurses are often overworked and underappreciated.
Right. They're dealing with long hours.
They are.
High patient loads. Emotionally demanding situations.
Right. So it's no wonder that many nurses are leaving the profession.
Yeah.
Or choosing to work in less stressful environments.
And we're also seeing an aging baby boomer population.
We are.
Which is placing increased demands on healthcare systems and exacerbating the need for more nurses.
It's a demographic shift that's putting a lot of pressure on the healthcare system as a whole.
Yeah. And to make matters worse, there's a shortage of nursing faculty.
There is.
To educate the nephew generation of nurses.
That's right.
This further limits the workforce pipeline.
It does.
Right.
Yes.
It makes it even harder to address the nursing shortage.
Absolutely. It's a complex problem with no easy solutions.
It is.
But addressing it is crucial for ensuring access to quality care for all.
Now, let's shift our focus to patient satisfaction.
All right.
In today's healthcare landscape, patient satisfaction is a key metric.
It is.
For evaluating the quality of care.
It's like patients are becoming more empowered and demanding a higher level of service from their healthcare providers.
Absolutely. Hospitals and healthcare providers are using surveys and feedback mechanisms.
Yes.
Right, to gauge patient experiences and identify areas for improvement.
Exactly. It's about making healthcare more patient-centered. Recognizing that patients are not just passive recipients of care. But active participants in their healthcare journey.
So the emphasis on good customer service.
Yes.
Treating patients like family and upholding the patient Bill of Rights. All reflect this focus on patient-centered care.
It's about creating a positive healthcare experience. That goes beyond just treating the illness.
You're absolutely right. And let's not forget, healthcare is a business.
It is.
Right. And patient satisfaction plays a key role.
It does.
In its financial sustainability.
Satisfied patients are more likely to return for care. Recommend services to others and contribute to the overall success of healthcare organizations.
Absolutely. Now let's delve into the complex world of managed care. Managed care is a system that aims to control healthcare costs while maintaining quality of care. So it's a balancing act.
It is,
That can have both positive and negative implications.
It can, yes.
It sounds like a challenging system to navigate.
It can be.
Right, for both patients and providers.
One of the key goals of managed care is to keep the length of stay in hospitals down. As this is a major driver of healthcare costs.
That makes sense, right? Hospitals are expensive.
They are.
And shorter stays.
Can help reduce costs. Exactly. And this can lead to practices like capitation, where healthcare providers receive a fixed payment per patient, regardless of the services provided.
So it's like a flat fee for healthcare, regardless of how much care a patient actually needs.
It's a bit more complicated than that, but essentially, yes. It can also lead to early discharge, where patients are sent home sooner to reduce those hospital costs.
That sounds a bit concerning.
It can be,
Right. What if patients aren't fully recovered or need additional support at home?
That's a valid concern, and that's why it's so important for patients to understand their healthcare plans and advocate for their needs.
And the increasing acuity of patients being admitted to hospitals adds another layer of complexity to managed care.
With more patients presenting with complex medical conditions, there's a growing need for specialized care and resources, which can strain the system and create challenges for providers.
So it's like the healthcare system is being stretched thin.
You could say that.
Right. Trying to meet the needs of an increasingly complex patient population.
Exactly. And healthcare plans play a significant role in managed care as they dictate which providers patients can see and what services are covered.
It's like a gatekeeper.
It can feel that way sometimes.
Right. Controlling access to healthcare services.
Yeah.
Based on the patient's insurance plan.
This can sometimes limit patient choice and create barriers to accessing certain types of care.
Right.
Understanding your healthcare plan and its limitations is crucial for navigating the system effectively.
It's like being an informed consumer.
Yeah.
Right?
Yeah.
Knowing your rights and options when it comes to your healthcare.
And case managers play a crucial role in coordinating care, communicating with physicians and insurance companies, and ensuring that patients receive the appropriate services within the constraints of their healthcare plan.
It sounds like they're the navigators.
That's a great analogy.
Helping patients find their way through the often confusing world of healthcare.
Their role is particularly important in managing complex cases, transitioning patients between care settings, and advocating for their needs within the managed care system.
So it's clear that managed care is a complex and ever-evolving system.
It is.
With both benefits and challenges.
Absolutely.
Now let's shift our focus to national patient safety initiatives, which aim to reduce preventable medical errors and improve the overall quality of care.
These initiatives are collaborative efforts involving healthcare providers,
organizations, and government agencies, all working together to create a safer healthcare system for all.
It's like a collective effort.
It is,
to make healthcare more reliable and less prone to errors.
Exactly. We'll be highlighting 3 key initiatives. The Joint Commission National Patient Safety Goals, the Institute for Healthcare Improvement's 5 Million Lives campaign, and the Leapfrog Group.
Let's start with the Joint Commission National Patient Safety Goals. What are they all about?
These goals are specific, measurable actions that healthcare organizations are expected to implement to enhance patient safety.
So they address critical areas like patient identification.
Yes, they do.
Communication among caregivers, medication safety, infection prevention, and fall prevention.
Exactly. And they also emphasize patient involvement in their own care. Empowering them to be active participants in their healthcare journey.
That's so important.
It is.
Right? Patients need to be informed and engaged in their care.
They do.
To ensure the best possible outcomes.
Absolutely. Now let's move on to the Leapfrog Group. They're all about empowering consumers to make informed choices about their health care.
That sounds interesting.
It is.
How did they do that?
They collect and publicly report data on hospital performance, focusing on safety and quality measures. This allows consumers to compare hospitals and choose those with the best track records.
So it's like a consumer report card for hospitals, helping patients make informed decisions about where to receive their care.
Transparency and accountability are key to improving healthcare quality and safety.
I love that.
Good.
It's about putting the power in the hands of the patients.
Exactly. Giving them the information they need to make the best choices for their health.
Absolutely. Now let's turn our attention to the IHI 5 Million Lives campaign, which focuses on implementing specific interventions and strategies to prevent medical harm and improve healthcare outcomes.
That sounds ambitious.
It is.
What are their key focus areas?
They target areas like deploying rapid response teams to address deteriorating patient conditions, delivering evidence-based care for heart attacks, preventing adverse drug events, and reducing healthcare-associated infections.
So there's like a multi-pronged approach.
It is.
Right, to tackling some of the biggest challenges in healthcare?
By implementing evidence-based practices, improving communication, and promoting a culture of safety, they're making significant strides in reducing preventable harm and saving lives.
It's incredible to see these initiatives in action, making a real difference in the lives of patients.
Now, let's talk about a field that's revolutionizing healthcare. Genetics. Advancements in genetic research are opening up incredible new possibilities for diagnosing, treating, and even preventing diseases.
Like we're entering a new era of personalized medicine.
We are.
Right. Where treatments can be tailored to an individual's unique genetic makeup.
Exactly. We've witnessed groundbreaking discoveries like the mapping of the human genome through the Human Genome Project, which has provided us with an unprecedented understanding of the genetic basis of disease.
So it's like we're unlocking the secrets of our DNA. Right.
Yeah.
Gaining insights into the root causes of diseases and developing targeted therapies to address them.
This knowledge is leading to the development of targeted therapies, personalized medicine approaches, and genetic testing that can identify individuals at risk for certain conditions.
So it's not just about treating diseases anymore.
It's not.
Right. It's about preventing them from occurring in the first place.
Exactly. And stem cell research holds immense promise for regenerative medicine, offering potential treatments for a wide range of conditions.
So like spinal cord injuries to heart disease.
Exactly.
Okay.
The possibilities seem endless.
It's like science fiction.
It is.
Becoming reality.
They do, but with these advancements come ethical considerations. Cloning, for example, raises complex questions about the boundaries of scientific exploration and the implications of manipulating genetic material.
It's important to have open and honest conversations.
It is,
about these ethical considerations.
Absolutely right.
As we move forward with genetic advancements in healthcare.
Now, let's broaden our perspective and consider the globalization of health.
All right. So in today's interconnected world, health is no longer just a local or national issue.
No.
Right. It's a global concern.
It's a global issue.
The ease with which people and diseases can travel across borders highlights the need for a global approach to healthcare.
You're absolutely right.
Right.
Nurses are increasingly recognizing the importance of understanding global health issues, such as infectious disease outbreaks, pandemics, and health disparities between countries.
It's about recognizing that the health of one population can impact the health of others around the world. We're all interconnected.
We are. And have you noticed any ways in which globalization has impacted?
I've definitely noticed a greater diversity of patients and healthcare providers in my community. It's a reminder that that health is a universal human right.
It is,
and that we need to work together to ensure that everyone has access.
We do.
To quality care, regardless of where they come from.
That's a great observation.
Thanks.
Now let's transition into the legal aspects of nursing, which are crucial for ensuring safe and ethical practice.
So nurses operate within
they do
a complex legal framework.
Yeah.
Right. That dictates their scope of practice.
It does.
Responsibilities and accountability.
Understanding this framework is essential for protecting both nurses and their patients.
Okay.
It provides clear guidelines for what nurses can and cannot do, ensuring that they're practicing within the boundaries of the law.
So where do these legal limits come from?
Okay.
What are the sources of law that govern nursing practice?
There are several sources of law that shape nursing practice. Statutory law, which includes nurse practice acts, is created by legislative bodies and defines the scope of practice for nurses in each state or jurisdiction.
It's like the rule book.
Exactly.
Right, that outlines the legal boundaries of nursing practice.
And regulatory law, also known as administrative law, outlines the rules and regulations that govern nursing practice, often created by state boards of nursing.
So it's like the finer details.
Yes.
Right.
Yeah.
The specific rules and procedures that nurses need to follow.
You got it. Then we have common law. Which is based on judicial decisions and precedent. It plays a role in shaping legal interpretations and defining standards of care. In nursing.
So it's like learning from past cases and court rulings, to guide current practice.
Exactly. And we can't forget about criminal law, which addresses offenses against the public and can include felonies and misdemeanors.
That sounds pretty serious.
It is.
When would criminal law be relevant to nursing practice?
In cases where a nurse's actions might violate criminal statutes, such as intentionally harming a patient or diverting medications for personal use.
So it's a reminder that nurses, like everyone else, are accountable for their actions under the law.
Absolutely. And finally, we have civil law, which focuses on disputes between individuals or entities. It's applicable in cases of negligence or malpractice, where a nurse's actions may have caused harm to a patient.
So it's about resolving disputes.
It is.
And ensuring that those who are harmed are compensated for their losses.
Exactly. Understanding these different sources of law is crucial for nurses to protect themselves from liability and ensure they're practicing within the legal boundaries of their profession.
It's like having a legal safety net.
It is.
Knowing the rules of the game and playing by them.
Now let's delve into some specific legal issues that nurses may encounter in their practice. These are real-world situations that require a deep understanding of the law and a commitment to ethical practice.
One of the most important legal documents for nurses is the Nurse Practice Act.
It is.
Yeah. Which we already touched upon.
The Nurse Practice Act is essentially the blueprint for nursing practice in each state. It defines the scope of practice, outlines licensing requirements, and establishes standards for education and conduct.
So it's like the Constitution for nurses, guiding their practice and protecting both nurses and patients.
And then we have standards of professional practice, which are often developed by professional nursing organizations like the American Nurses Association. These standards provide guidelines for ethical conduct, clinical decision-making, and quality of care.
So it's like a code of conduct.
Exactly.
A set of principles that guide nurses in making the best possible decisions for their patients.
And EMTALA, the Emergency Medical Treatment and Active Labor Act, is a federal law that has...
I've heard of EMTALA. What does it do?
It ensures public access to emergency services, regardless of their ability to pay. So if someone comes to an emergency room, they must be stabilized and treated regardless of their insurance status or ability to pay.
That's so important.
It is.
It ensures that everyone has access to emergency care when they need it most.
That's right.
What other legal issues do nurses need to be aware of?
Well, advance directives are legal documents that allow individuals to express their healthcare wishes in advance. This might include things like living wills or durable power of attorney for healthcare.
So it's about giving patients a voice in their care.
Yeah.
Even if they become incapacitated and unable to communicate their wishes.
And IPA, the Health Insurance Portability and Accountability Act, protects the privacy and confidentiality of patient health information. Nurses are legally bound to adhere to IPA's strict regulations.
Privacy is so important.
It is.
In healthcare, patients need to feel confident that their personal health information is being handled with care and confidentiality.
Absolutely. And then we have licensure, the process by which nurses are granted permission to practice. This ensures that they've met minimum competency standards and adhere to ethical and legal requirements.
It's like a seal of approval.
You could say that.
Yeah. Verifying that a nurse is qualified and competent to practice.
And Good Samaritan laws offer legal protection to healthcare providers who render aid in emergency situations outside of their work setting.
That's a great law.
It is.
It protects healthcare workers who are trying to do the right thing and help someone in an emergency.
What about public health laws? How do they relate to nursing practice?
Public health laws address issues that affect the health of the population as a whole.
Such as communicable disease reporting, immunization requirements, and environmental health regulations.
So nurses play a role in protecting the public's health. By adhering to these laws. And reporting any potential health threats.
Exactly. And then there are issues like physician-assisted suicide, which can raise ethical and legal dilemmas for nurses involved in end-of-life care.
That's a complex issue.
It is.
With varying legal implications depending on the jurisdiction.
Yes. It's a reminder that nursing often involves navigating sensitive and ethically challenging situations.
Absolutely. And the Americans with Disabilities Act, or ADA, prohibits discrimination against individuals with disabilities, requiring healthcare providers, including nurses, to provide accessible and equitable care to all patients.
That's an important law.
It is.
It ensures that everyone, regardless of their abilities, has equal access to healthcare services.
Now let's explore some civil and common law issues that can arise in nursing practice, as these can have serious legal and professional consequences.
They can, yes.
When we talk about civil law, we're often referring to torts, which are civil wrongs that result in harm to another person.
Right. Torts can be either intentional or unintentional. Intentional torts involve deliberate acts that violate another person's rights.
So like assault, battery, false imprisonment.
Those sound pretty serious.
They do.
Hopefully those situations are rare, but they can occur. And unintentional torts occur when a person's actions, while not intended to cause harm, result in injury or damage to another.
So it's like an accident, but one that could have been prevented if the nurse had acted with more care or diligence.
Exactly. Negligence is a common legal issue in healthcare. And it occurs when a nurse fails to provide care that a reasonably prudent nurse would have provided under similar circumstances. And this breach of duty results in harm to the patient.
So it's like not meeting the expected standard of care.
You could say that.
Right. Making a mistake that a competent nurse wouldn't have made.
And malpractice. It's a specific type of negligence that occurs when a professional, such as a nurse, fails to meet those accepted standards of care within their profession, resulting in harm to the patient.
So it's like negligence, but with a higher standard of care expected, due to the nurse's professional status.
That's right.
And training.
And consent is a fundamental legal and ethical principle in healthcare. Nurses must ensure that patients have given informed consent before any treatment or procedure.
So informed consent means that that patients understand the risks and benefits of a treatment or procedure before agreeing to it.
Absolutely. And it also means that they have the right to refuse treatment, even if it's recommended by their healthcare provider.
So patient autonomy is so important.
It is.
Right?
So,
patients have the right to make decisions about their own bodies and their own healthcare.
Absolutely. And malpractice insurance is crucial for nurses as it provides financial protection in the event of a lawsuit alleging negligence or malpractice.
It's like a safety net for nurses. Protecting them from financial ruin in the event of a legal claim.
And finally, abandonment and assignment issues can arise when nurses are assigned tasks or patients that fall outside of their scope of practice or when they leave a patient without appropriate handoff of care.
So it's about ensuring that nurses are working within the boundaries of their training and expertise. And that patient care is never compromised.
That's right.
Now, let's shift our focus to the challenges of nursing administration. Strong leadership and effective management are crucial for creating a supportive and efficient work environment. Nurses.
You're right. Nursing administrators often face a unique set of problems that can hinder their ability to effectively lead and manage nursing staff and resources.
So what are some of these challenges?
Well, one common problem is the lack of involvement of nursing administrators in planning and decision-making processes within healthcare organizations.
That's frustrating.
It is.
Nurses are the ones on the front lines.
They are.
Right. So their voices should be heard. When it comes to making decisions about patient care.
They should.
And the allocation of resources.
Absolutely. Another challenge is the lack of specific power assigned to nursing leaders. While they may be responsible for managing nursing staff and resources, they may not have the authority to make key decisions that impact nursing practice or patient care.
So it's Like they're being held accountable for outcomes,
right?
But don't have the power
Yeah.
to influence the factors that contribute to those outcomes.
And limited knowledge of management principles can be another obstacle.
Okay.
Some nursing administrators may have excelled in clinical roles,
Right.
but lack formal training and experience in areas like budgeting, staffing, and conflict resolution, which are essential skills for effective leadership.
So it highlights the need for
it does
for leadership development programs.
Yeah.
Right. That prepare nurses for administrative roles and equip them with the skills they need to lead and manage effectively.
You're right. And unclear written policies and manuals can create confusion and inconsistency in nursing practice.
Yeah, it's like everyone's playing a different game with different rules.
Yeah.
Clear policies and procedures are essential. Right.
They are.
For ensuring that that everyone is on the same page.
Yeah.
And working towards the same goals.
Absolutely. And poorly defined job descriptions can lead to role ambiguity, conflicting expectations, and a lack of clarity about responsibility.
Right. It's like not knowing what you're supposed to be doing or who's responsible for what.
That's right.
Clear expectations. And well-defined roles are essential.
They are.
Right. For creating a cohesive and efficient team.
These challenges highlight the need for healthcare organizations to invest in nursing leadership.
Okay.
Create clear policies and procedures.
Right.
And empower nursing administrators to make decisions that impact nursing practice and patient care.
So it's about creating a supportive and empowering environment.
It is.
Right. Where nurses can thrive. And contribute their expertise to improving healthcare.
Now, let's continue our exploration of common problems in nursing administration, focusing on obstacles that can hinder progress and innovation within the profession.
One significant challenge is poorly organized staff development programs.
Yes. Inadequate training and professional development opportunities can limit nurses' ability to stay abreast of the latest advancements in healthcare and acquire new skills.
Right. So continuing education is essential for nurses to maintain their competency.
Absolutely.
Right. And provide the best possible care.
That's right.
So investing in staff development is a win-win.
It is.
Right?
Yeah.
Benefiting both nurses and patients.
And what about the role of nursing councils in maintaining standards?
Right.
How do they contribute to addressing challenges within the profession?
Right.
Nursing councils are responsible for upholding ethical guidelines, ensuring competency, and addressing complaints.
Right.
However, they can sometimes be slow to respond to issues or lack the authority to effectively enforce standards.
So it's like they're the watchdogs.
Yeah, you could say that.
Of the profession.
Yeah.
Right. But they don't always have the teeth to bite.
And inadequate efforts to implement a separate directorate of nursing can also hinder progress.
What does a directorate of nursing do?
Having a dedicated nursing leadership structure can ensure that nursing concerns are represented at the highest levels of decision-making within healthcare organizations.
Okay.
It gives nursing a voice at the table when it comes to setting policies and making decisions that impact patient care and the nursing profession.
So it sounds like having a directorate of nursing is essential.
Yes.
For ensuring that nursing is a priority within healthcare organizations.
Absolutely. And limited educational preparation of nurses can pose challenges for leadership roles.
So while clinical expertise is essential.
It is.
Right. Strong leadership skills, business acumen, and a deep understanding of healthcare systems are also vital for effectively managing nursing departments and advocating for the needs of nurses and patients.
You're right. It's not just about clinical skills. It's about developing leadership competencies that equip nurses to manage teams, make decisions, and navigate complex healthcare systems.
And resistance to new roles.
Yes.
Right?
Yeah.
And adherence to tradition can sometimes hinder innovation and prevent nurses from embracing those new opportunities for professional growth.
It's about creating a culture that embraces change and encourages nurses to take on leadership roles, specialize in new areas, and contribute to the evolution of the profession.
It's about Embracing the future of nursing.
Exactly.
Right.
And finally, a lack of unity among nurses can weaken their collective voice and make it more challenging to advocate for their needs and influence healthcare policy.
It's like the old saying, divided we fall, united we stand.
It is.
Right. A unified voice is essential.
It is.
Right, for nurses to advocate for their profession and shape the future of healthcare.
Strong professional organizations and a sense of solidarity are essential for nurses to effectively address challenges, advocate for their profession, and influence healthcare policy.
Now let's dive into the world of hospital-based nursing, which remains the practice area for the largest group of nurses.
It's a fast-paced, demanding, and incredibly rewarding environment where nurses provide acute care to patients with a wide range of medical needs.
So it's the heart of healthcare, right?
It is.
The place where life-saving interventions occur. And where nurses are on the front lines.
That's right.
Providing that compassionate care and expert interventions.
Hospitals are constantly evolving to meet the changing demands of healthcare.
Right.
And this is reflected in the various staffing patterns and skill mix we see in hospital settings.
So what are some of the trends in hospital-based nursing?
Well, traditional models of nursing care with nurses assigned to specific patients are being replaced by team-based approaches where nurses collaborate to provide comprehensive care to a group of patients.
So it's moving away from a one-on-one model to a team-based approach.
Exactly. This shift towards team nursing allows for more efficient use of resources and expertise.
Right.
But it also requires strong communication and coordination among team members.
It's about working together, right? Leveraging each team member's strength to provide the best possible care.
And the skill mix of nurses in hospitals is also changing.
What does that mean?
We're seeing an increase in the need for nurses with specialized skills, like critical care, emergency medicine, and oncology, as the acuity of patients being admitted to hospitals continues to rise.
So hospitals are dealing with sicker patients.
They are.
Right, who require a higher level of care, and that's driving the need for more specialized nurses.
And this shift towards specialization demands ongoing investment in continuing education and professional development for nurses to ensure they have the necessary skills to provide high-quality care to these increasingly complex patient populations.
So it's like nurses are constantly upskilling, learning new things.
We are,
adapting to the changing demands of healthcare.
And we can't forget about the aging population and the rise of chronic diseases. This trend is leading to an increase in skilled nursing facilities and long-term care settings.
So while hospitals are dealing with more acute care needs, there's also a growing demand for nurses in settings that provide long-term care and support to individuals with chronic illnesses.
Exactly. Nurses working in these settings need to be adept at managing chronic conditions, providing palliative care, and supporting patients and families through those long-term health challenges.
So it's about providing holistic care.
It is, right.
That addresses not only physical needs, but also emotional, social, and spiritual well-being.
You're right. Now let's step outside the hospital walls and explore the world of community-based nursing, which is expanding the reach of healthcare and transforming the way care is delivered.
Community-based nursing is about meeting people where they are,
Exactly.
Providing care and support within the context of their communities.
It focuses on promoting health, preventing illness, and providing education and support to individuals and families within their own communities.
So it's about empowering individuals.
It is.
To take control of their health and well-being, equipping them with the knowledge and resources they need to live healthy lives.
Community health centers and clinics are often the first point of contact for individuals seeking healthcare services, particularly in underserved communities.
They play a vital role then.
They do.
In providing access to care for those who might not otherwise have it.
Nurses working in these settings provide a wide range of services, including primary care, health screenings, immunizations, and health education programs.
It's about meeting the diverse needs.
That's just immunity.
Right, yeah. And providing care that's tailored
yes.
to the specific challenges and resources of that community.
And school nursing plays a vital role in promoting the health and well-being of children and adolescents.
I remember the school nurse from when I was a kid. Yeah. She was always there to patch us up when we fell on the playground and make sure we were up to date on our vaccinations.
School nurses are amazing.
They are.
They provide first aid, administer medications, manage chronic conditions, and educate students and staff about health and safety.
So they're like healthcare superheroes.
You could say that.
Right.
Yeah.
Keeping our schools healthy and safe.
And occupational health nurses focus on preventing and managing work-related illnesses and injuries, promoting a safe and healthy work environment, and providing health education and screenings to employees.
So they're the guardians.
Yeah, you could say that.
Of workplace health and safety, right? Ensuring that employees have the resources and support they need to stay healthy and productive.
Exactly. And home health nursing brings healthcare services directly to patients in their homes, providing a wide range of services.
Right. So that includes skilled nursing care, medication management.
Yes, it does.
Wound care, and physical therapy.
That's right.
It's like bringing the hospital to the patient.
It is.
Right. Yeah. Providing care and support in the comfort of their own homes.
And physician offices?
Rely on nurses to provide a variety of clinical and administrative support, including taking patient histories, administering medications, assisting with procedures, and educating patients about their care.
So they're like the multitaskers of healthcare, juggling a wide range of responsibilities and keeping the office running smoothly.
And managed care organizations often employ nurses to coordinate care, case manage complex patients, and ensure that patients are receiving the appropriate services within their healthcare plan.
It's like being a patient advocate, right?
You could say that.
Navigating the complexities of the healthcare system and ensuring that patients are receiving the care they need.
And forensic nursing is a specialized field that combines nursing knowledge with forensic science.
That sounds fascinating.
What do forensic nurses do?
They address issues related to crime, violence, and abuse. They might provide care to victims of crime, collect evidence, provide expert testimony in legal proceedings, or advocate for policies to prevent violence and abuse.
So it's like they're detectives and healers. Right. Using their skills and knowledge to address the intersection of healthcare and the medical system.
It's a truly diverse field that showcases the many ways in which nurses are contributing to the health and well-being of individuals and communities beyond traditional healthcare settings.
It's inspiring to see how nursing is expanding its reach and impacting so many different areas of our lives.
Now let's talk about nursing education, the foundation upon which the entire profession is built. The journey to becoming a nurse requires rigorous training and education. And there are various pathways one can take to enter this rewarding profession.
So it's like choosing your own adventure.
It is.
Right.
Yeah.
There's so many different paths to becoming a nurse.
Traditionally, nurses received their training through diploma programs offered by hospitals. These programs typically lasted 3 years and focused on developing clinical skills and bedside nursing expertise.
It was a very hands-on, practical approach to nursing education. And then came the associate degree in nursing. A 2-year program offered by community colleges and universities. Which provided a more academic foundation in nursing theory and science.
That's right.
So the ADN pathway opened up nursing education.
It did.
Right?
Yeah.
To a wider range of students, making it more accessible and affordable.
And the Bachelor of Science in Nursing, a 4-year program offered by universities, emerged as the gold standard for nursing education. It provides a comprehensive education in nursing science, research, leadership, and community health.
So it's like the bachelor's degree is becoming the new baseline.
It is,
right? For nursing, equipping nurses with a broader range of knowledge and skills.
Exactly. And for those seeking advanced practice roles or leadership positions,
Okay.
there are master's and doctorate level programs available,
Right.
offering specialized training in areas
Right.
like nursing administration, education, research,
Right.
and clinical practice.
It's amazing how nursing education has evolved over time.
It is.
To meet the changing demands of healthcare.
That's right.
There's so many opportunities for nurses to specialize.
There are.
Right.
Yeah.
And advance their careers.
And continuing education is a vital aspect of nursing practice.
Right.
Ensuring that nurses stay abreast of the latest advancements in healthcare, maintain their competency, and meet licensing requirements.
So it's about lifelong learning, isn't it?
It is.
Recognizing that healthcare is constantly evolving.
Yes.
And that nurses need to adapt and grow.
They do.
To keep pace.
Exactly. Nurses can participate in a variety of continuing education activities, such as attending conferences, workshops, online courses, and reading professional journals.
Right.
To enhance their knowledge and skills throughout their careers.
So it's like they're always adding tools.
Yeah, they are.
To their toolbox,
Yeah,
right?
yeah.
Expanding their knowledge base.
Yeah.
And refining their skills.
That's right.
To provide the best possible care.
And in-service education provided by healthcare organizations focuses on specific skills or knowledge needed within a particular work setting.
So it's about making sure that that nurses are competent to perform their duties safely and effectively. That's right.
In their specific work environments.
It's all about continuous learning.
Yeah.
And professional growth.
Well, it sounds like nursing is an incredibly dynamic and rewarding profession.
It is.
And one that's vital to the health and well-being
It is.
of individuals and communities around the world.
That's right.
So thank you for joining us.
You're welcome.
On this deep dive into the world of nursing.
Thanks for having me.
And a special thanks to London HeartbeatsZ Academy UK for their support in making this episode possible.
It's wonderful.
For our listeners.
Yeah.
We encourage you to learn more about London HeartbeatsZ Academy.
Yeah.
They offer over 140 healthcare courses.
That's right.
And provide valuable resources on their social media channels. You can find them on Facebook, Instagram, Spotify, and YouTube.
And be sure to subscribe so you don't miss out on their free updates and future discussions just like this one. Well, that's all the time we have for today's deep dive into nursing.
Thank you.
Until next time, stay curious, stay informed, and take care of yourselves and each other.